Refractive procedures can also be used to treat a condition known as presbyopia. This is when you begin to notice that small print becomes difficult to see and you need glasses for reading. As we age, usually around the age of 40, the lens inside our eye begins to lose the ability to change shape, which gives us the ability to shift our focus from distant objects to something up close.
I had a traditional LASIK eye surgery. I had a treatment called monovision, and it enables me to see near and far. I have the best of both worlds. I can see to read, and I can also see to drive or any distance, so I don't need to wear glasses for anything.
We can now, by the way, do monovision, where we set one eye for distance and we make one eye slightly nearsighted. So if a person is very nearsighted, we would leave a little bit of residual nearsightedness in the reading eye so that they can read up close and use the dominant eye for distance. That's called monovision. If people are farsighted, I think it'll be possible to correct one eye for distance and similarly make the other eye slightly nearsighted so that they can read.
So if you're nearsighted, farsighted, or have an astigmatism, these types of refractive errors are generally treatable with today's laser vision correction procedures. The type of laser used in laser vision correction is known as an excimer laser. The excimer laser is a cold laser that gently and precisely breaks the molecular bonds in the cornea that holds tissue together, vaporizing and removing small amounts of tissue, much often less than the thickness of a human hair. The laser reduces the steepness of the cornea, bringing the light rays to a point of focus on the retina. The LASIK procedure evolved by combining two proven vision correction procedures and has become the procedure of choice globally by refractive surgeons. The first step in the LASIK procedure is to create an ultra-thin corneal flap. This flap technology is known as ALK that perfected the lamellar keratoplasty procedure developed by Professor Barraquer in the late 1940s. Then the excimer laser, with its multiple decades of history, is used to remove a small amount of tissue beneath the flap, correcting the refractive error. Because the cornea is the fastest healing organ in the body, the flap becomes quite secure within 12 to 24 hours. This amazingly fast healing process enables many of our patients to return to work the very next day.
I could see immediately, and I wasn't supposed to, but I snuck a little peek and I could actually read license plates on the way home, a couple of cars ahead.
The very next day, after my surgery, I drove myself to my follow-up appointment, and then I went right on the treadmill. So I had no problem exercising or resuming my normal activities.
There are two ways to perform the LASIK procedure, by using either a traditional or custom approach. Traditional LASIK corrects vision based on the patient's prescription for glasses or contacts. These are also known as lower order aberrations. High-definition custom LASIK with Xioptics wavefront from Bausch & Lomb has the ability to track and treat the irregularities known as higher order aberrations, which are not correctable with glasses, contacts, or traditional LASIK. Higher order aberrations are irregularities which are uniquely different in every eye, just like fingerprints. Have you ever noticed a glare or halo effect around lights when driving at night? Normally, the light rays that enter the eye are traveling parallel. However, depending on the degree of irregularity in your eye, these light rays will not be able to follow their natural path, causing you to lose the ability to see things with the highest degree of clarity, crispness, and contrast. These irregularities within your eyes can cause glare and halos at night. Identifying, tracking, and treating these higher order aberrations can potentially help improve your night vision up to 40%. The increased safeguards of high-definition custom LASIK enable us to potentially help people see better than they ever could with corrective lenses.
I had high-definition LASIK surgery. It's the latest and the newest, and feels like it's the best.
The Ellis and Laser Medical Center provides free evaluations. This is the best way to determine your candidacy for any vision correction procedure. If you are a good candidate, we will discuss and determine which technology is best to correct your vision.
The best candidates for refractive surgery are people who don't like wearing eyeglasses, have problems with contacts, they may have allergies, they may have difficulty tolerating the lenses, irritation to the eye, they may be in professions where glasses or contacts are not good, such as police work or fire work.
Wearing corrective lenses can often interfere with a person's ability to achieve their full potential in both their personal and professional lives.
I think the activities at work that were really improved were working on the computer became easier, working at for longer amounts of time looking at the computer because my eyes weren't drying out.
Each patient's vision is uniquely different, and in some cases we may determine that alternative vision correction procedures better fit your vision correction needs. A good example is a procedure known as CK, which stands for conductive keratoplasty. CK uses radio frequency to change the curvature of the cornea as opposed to using a laser. The CK procedure may very well be the best alternative for those who are over the age of 40 and only wear glasses for reading. The Ellis Eye and Laser Medical Center is recognized internationally because of Dr. Ellis's unique background, experience, and certification in refractive surgery in both incisional keratectomy and LASIK. For decades, the excimer laser has been used for correcting vision globally, and it has the ability to remove a quarter micron of tissue with each pulse. The beam is so precise that it can make notches in human hair. Dr. Ellis is degreed in electrical engineering and ophthalmology. He fully understands the lasers and their relation to visual excellence. His combined professional experiences ensure that his surgical skills have been scrutinized and the lasers he uses are delivering an accurate homogeneous beam to provide the best possible outcome. Dr. Ellis's unique background in degreed electrical engineering and ophthalmology provides his patients with the confidence that they can trust their eyes to experience. People are tremendously fearful of any type of eye procedure, and it's natural to have concerns about refractive surgery. That's why you should be concerned about who performs your procedure. Surgery is an art, and it requires exacting surgical skill. Therefore, you should make sure that the surgeon performing your procedure has had their surgical skills tested and evaluated to ensure their ability to correct your vision.
I felt that Dr. Ellis had the most experience. He was one of the first in the U.S. to start this kind of treatment, and he was Stanford trained. He had the credentials that I was looking for, and I think it's very important to find the right surgeon to do the job. Price is not the only factor.
Many of us who began all of the procedures in the 1980s have perfected different techniques, and so we can utilize a combination of techniques to correct the nearsightedness or the farsightedness. I think the knowledge of the surgeon, the experience of the surgeon is very, very important. This is not a technician-directed procedure where we're going to use a computer and it's going to work for everybody. But unfortunately, people have special needs, and there can be various complications and problems developing from using a one-size-fits-all procedure.
During the surgery, Dr. Ellis told me first to look at the clock that was on the wall, and I couldn't see anything. It was a blur. Then my eyes were numbed, and he opened up my eyelids with a little prop thing, and then there was a big flash of light, and then he went to the next eye, and that was it. And then he said, open your eyes and look at the clock. And it was 1:45. I could see the clock. It was pretty cool.
By now you're probably asking, what does this cost? Well, over time, if you compare the annual cost of doctor visits, contact solutions, prescriptions, and your waste of time dealing with glasses and contacts, you may find it cheaper to have a procedure performed. Many patients find it's one of their best investments because it's dramatically changed the quality of their lives.
I would have paid twice as much that I paid for getting this kind of vision restored. I have been selling this nonstop to all my friends and to my family. The cost, you just cannot compare the lifestyle change and improvement to that price, to any price really.
The staff at the Ellis Eye and Laser Medical Center offers convenient locations, free evaluations, and affordable payment plans. We are dedicated to your goal of clear vision and will do everything possible to ensure a successful and pleasant experience.
Dr. Ellis was very comfortable to talk to. He gave me confidence that this procedure would turn out for me, and his whole office was just very nice to work with. They were very kind. I was very scared, and they were more than kind in how they took care of me.
Call the Ellis Eye and Laser Medical Center. Let us help you see a more beautiful and brighter future.
I'm really happy with the surgery. I just feel transformed. My life is just feels so much more freer.
I would do it again in a heartbeat if I needed it. It was a beautiful experience. I didn't ever feel uncomfortable, and I walked away from the experience with a wonderful feeling. Every day is a great day.
I think it's just life-changing, and I had no reservation at all, and I don't hesitate to recommend Dr. Ellis to all my friends and family.
Call the Ellis Eye and Laser Medical Center to see if you can benefit from this advanced laser technology. Call 1-800-C-SHARP. That's 1-800-733-7427. Trust your eyes to experience. Call 1-800-C-SHARP.